Use running drills progressively for successful return to run programs. So, return to run programs have incorporated different aspects and different rehabilitation tools. The problem is that a lot of coaches, a lot of performance athletes will use running drills, and they'll oftentimes be asking when they should use running drills during rehabilitation. Well, the thing is that many clinicians aren't sure when to use running drills, or historically they've used them for performance rather than return to run purposes or recovery and rehabilitation purposes. Now, new research is showing that running drills are effective to reintroduce load and impact along with tissue load to patients recovering from running injuries, which is great. We want to be able to use running drills effectively and have an evidence-based way to be able to implement them during rehab. So, a quick summary of clinical pearls. Running drills are going to provide plyometric strength during rehab and return to run programs. The A-skip, B-skip, and bounding are particularly useful. And then also we want to look at the highest and lowest impact drills in terms of external load. That's going to be your ladder single leg hop forward, which is going to be 2.8, the amount of body weight. And then you have the squat mini jump, which is going to be on the low end, 1.02 body weight. So let's talk a little bit more about the different ankle and foot running drills. And here, the most common ones, A-skip, B-skip, bounding. Okay, so the A-skip and B-skip are both going to have similar ankle power output as running. They're also going to have less midfoot power output than running. And they're also going to have minimal ankle dorsiflexion. That's going to make them really good for Achilles tendinopathy rehab, because it's not going to put them into a dorsiflex position, which is going to potentially aggravate Achilles tendinopathy. It's also going to have a similar ankle output. So ankle power output is going to be similar to running, which is going to be a nice way to mimic running and reintroduce running. You can also do it in a slower, more controlled way than just having someone go run. So these two are great tools to use for Achilles tendinopathy. However, for plantar fasciopathy, the A-skip is good, the B-skip not so good. The reason for that all comes down to the MTPs. So less MTP power output than running is during your A-skips, which is going to make it good for plantar fasciopathy. It's going to be able to control that load at the MTPs. We know MTP extension under load is going to be an aggravating factor potentially, or stressful factor for plantar fasciitis, right? So during the B-skip, however, we see that it's going to have higher load at the MTPs. It's going to be effective to improve ground push-off with minimal midfoot loading. However, that's going to make it more stressful for plantar fasciopathy. So, good things to keep in mind. Now let's lastly talk about bounding here. So higher ankle power output than running, which is interesting because obviously we want to be able to look at tools that can increase our power output. So that's a really helpful thing for us to know. However, there's less power output from the midfoot and the MTPs, which is also significant to note. And that's going to require it's also going to require a significant amount of dorsiflexion as well. So what is that going to make it good for? Well, it's not going to be as good for Achilles tendinopathy because it's going to require dorsiflexion. It's also going to have a lot of ankle output in terms of power. However, for plantar fasciopathy, it's good because it's going to have less power output from the midfoot and also from the MTPs, while we have a higher output from the ankle. So bounding can be a great drill. Now, if you do want to learn more about A-skip and B-skip and bounding, we have a ton of links and runner resources. Go ahead and check those out. You can go ahead and look at the videos and explanations of how to do the drills. So when it comes to all of these different issues and when it comes to running drills, a couple things we want to take away. We've talked about most of this information already, and I just want to highlight one or two things for you. And that is that specifically the A-skip and B-skip drills are going to be really, really good ways to reintroduce running along with bounding. But remember that bounding has a lot of power output at the ankle. It also requires a lot of dorsiflexion. That's going to be a really, really important one because, again, if someone can't tolerate dorsiflexion, if they can't elongate that calf, that tendon, the Achilles tendon, you're going to potentially have some problems, some issues there. And then think about your MTP extension load as well. That's going to be another big factor, especially for plantar fasciitis. So the A skip alone is going to require less MTP power output, where the B skip is going to require more power output there. So while power output is really important, we also want to think about external load that's being placed on the foot. Now this is really important because we want to think about progressively loading impact drills when it comes to running drills to be able to recover from things like bone stress injuries. This is also really helpful postpartum as well. For mothers experiencing prolapse or incontinence, you want to gradually add more load. This can be an important way to add progressively more load. So we're going to want to start by slowly progressing the duration of the drills. That's going to be a really good way to start. So start by progressing the duration with a low impact drill. Some experts say that drills such as the A skip and B skip should be at a dosage of 3 to 5 reps of 15 meters. So the next thing to do would be to progress drill intensity, and that's going to be using low impact drills. Again, we can start with an easy pace and progress towards a fast pace. The more fast pace is going to be more stressful. And then lastly, we want to think about frequency. How often are we doing these drills? Some research is showing that we can actually progress drills every other day, but the research is a little bit lacking here. This is something that definitely needs more research. And again, we can find more details on all of these different peak impacts and loading forces in terms of each running drill in runner resources. I'll take you through a quick tier system here, and that's basically this research was able to show how much each of these different running drills were able to impact the body. Now the impacts are going ahead and felt external loads. We have things like a squat mini jump progressing up to a bigger jump, and then getting up to things like a large forward jump, a ladder icky shuffle. All these different drills you can see here, they're all based on different numbers here, and they're basically going to be shown on the amount of body weight. So that's going to be 1 times the amount of body weight, or 2 times, or whatever the number is, and then also the percentage of 10K race pace. So how much force is being put on the body, and each of these drills is going to be the percentage of that race pace on a flat ground. Tier 2 drills are going to be things like running upstairs, or it's going to be potentially like ladder quick steps, or potentially like a stair shuffle. And then we can talk about wall knee drives as well. And then in tier 3, you can see things like a Bulgarian split hop, the A skip, the B skips here, the Karyokas are here as well. A wall knee drive fast is another one that's here. And then we have tier 4, especially helpful can be an easy hill run, because that's going to be a really, really good way to be able to have someone run. They can load up the muscles and their aerobic system without putting a lot of impact through their body. However, think about Achilles stress. That's going to increase Achilles stress. We're just talking about external load here for this section. And then we can look at a couple other ones like easy butt kicks. We can talk about fast high knees. All of these are going to be a bit more. You can see bounding is really high on the list. This puts a lot of impact through the body. So again, as we talked about, each of these are going to be calculated in terms of body weight and the percentage of 10K race pace in terms of the impact. And we also can see that particularly useful is that uphill running can be really, really good. Also, we want to use caution. We want to be careful. While we are just talking about impact and external load in this section here for these drills, it's also important to not forget about what we already learned about the tissues and the power output that's put on each of the different joints at the foot and ankle. And again, more research is really needed at the knee and hip as well.